Thank you so much for still being with us on NTV Weekend Edition. I am Priscilla Regina Naluoga with Susan Mujao Ananda on sign language. Now, June is Mental Health Awareness Month, and according to the latest report by the Uganda Bureau of Statistics, around 12% of Ugandans are living with mental health disorders, with women reporting slightly higher prevalency rates. Yet, despite this, there's growing concern that men are often overlooked when it comes to mental health support and care. To help us understand this gap and shed light on the challenges men face in seeking mental health services, we are joined by Eliah Motto, a clinical psychologist at Mental Health Uganda, and he's going to be talking to us on Talk of the Nation. Good evening, Eliah.
Good evening.
I'm so glad that you're a gentleman I'm having this conversation with.
Thank you so much for inviting me.
All right, so let's start off with the situation in northern Uganda, where we see that cases of men who have suffered from trauma during the conflict have often been neglected and left out. Why is that the case?
Thank you so much. First of all, good evening, our dear listeners. I must say that when it happens to northern Uganda after the post-war, you find that, yes, many organizations were in the region to support person mental health challenges, but as the society looks that many times it is the women who are much vulnerable to mental health conditions, so many of the NGOs or the well-wishers focus so much on the female, and men were actually ignored, forgetting that actually also men equally go through mental health conditions. So this actually led to the rise of mental health condition among men than actually women. But however, as per the report you've discussed by Uganda Bureau of Statistics, it indicates about 12% is individuals are going through mental health condition, and women are higher statistics. But you find that because men have the stigma around mental health, men don't actually go and seek the help. That's why you find that the digits might actually be a bit lower in terms of men actually report with mental health condition. But actually also men go through a lot of mental health conditions.
All right, so for the case of northern Uganda, how can we be able to rectify that challenge and that gap for men in order to then increase their access to mental health services?
One of the ways, one of the challenges that we are facing, that in northern Uganda is actually facing, is access to mental health services. There's inadequate access to mental health services. If you look at the public mental health services, you find that it is under-resourced, that the few mental health practitioners in the hospitals, but also some of these facilities don't actually have medication in time when people need the medication. So first of all, we need to increase the resource or the budgeting that is allocated to mental health, so that the resources that are in the facility are actually enough for every person who needs the mental health support. Then the other two is the other point we need to look at is normalizing mental health, awareness creation. Very many individuals outside there in the communities, much as in the urban setting here, people might understand mental health, but if you reach out in the rural areas like in Gulu, other parts of Lira, and the affected areas, many people don't understand what mental health is, because they don't understand, so they see no reason to actually seeking help, and they feel that might not be a problem. But if people understand mental health, where they can seek help, early signs, then they're able to actually seek the help.
Okay. Eliah, let's be more realistic. You're a man, and we're in an African setting, right, where men are supposed to look like they've got it all together. So could we not say that it's primarily a societal issue or a culture-related issue that men are not seeking out these services the way we would want to see them do it?
Yeah. One of the major, I would say that one of the major contributing factors to men not seeking mental health services is a culture factor. The culture has put it outside there that, men are always strong. Men do not cry. But also the culture makes it hard there that whoever is maybe diagnosed with mental health condition, they actually label, as mad, in quotation, but also they're actually a cursed family. So no man wants to be identified as a failure, but also as, someone with a cursed family. The other contributing factor I would look at high levels of stigma. The community has stigmatized people. So there is, when a man goes to seek service, so then they will look at them as, oh, this person is actually weak. So how can a man go to seek service just for counseling? How can a man go into depression? that means that he has actually even failed to actually provide for his family. So because of the high levels of stigma, the high levels of stigma, the cultural factors, but also a low levels of awareness creation, these are one of the biggest contributing factors that men or the community actually there do not seek help around mental health.
Let's also talk about the service centers where they can seek this help from. I feel like we've seen these cases in sexual reproductive health awareness, and how when men go there for services, they're given that look of, what are you doing here? You should have it all together. So on the side of the service providers for mental health, are they also making it an enabling environment for men to comfortably walk in and receive these services?
I must say that the mental health services that are actually out there, they're for everyone who has a mental health condition. But again, I want to emphasize that, for example, at Mental Health Uganda provides comprehensive free psychosocial support services to persons with mental health challenges. But because of the high levels of stigma, men don't want to seek that help. And that is why they actually prefer to seek help in silence. For example, according to our report as a Mental Health Uganda, after undertaking a project for the past 4 years, it indicates that actually, men actually call in more than the women to actually seek the help, because the service is actually online. They don't want to be seen at the health center, but they actually need the service. So it's not that the health centers don't support the men, but just because that the men feel stigmatized and men feel that they can't seek the service, but they prefer to get the service. Yeah,
but you see, Eddie, I believe they can't get the full benefits of the services unless they walk into the health centers. Yeah. So how do we get to attract our men to come from making phone calls comfortably to walking into the service centers comfortably?
One of the strategies we can put in place is normalizing mental health talk. Putting an environment whereby you feel free to talk about mental health as a man, just as a woman would feel free to talk about mental health. That whoever talks about mental health is not seen like, oh, this is someone who is about maybe to die, someone who has been cast. But if this is normalized in the community, then there will be low levels of stigma. So a man will feel free to actually seek mental health services just in case when they need. But because right now there are high levels of stigma, no man is going to walk into the facility freely. No one wants to be seen into the facility to seek help. They want it when they're actually in hiding.
Okay. That being said, let's talk about how the services are also being designed. Many a times they're designed to attract women comfortably or easily, and the men are left out in some of these campaigns that are run within community centers, some of the awareness programs that are put out there in the community centers. Perhaps there's even more women who come in as service providers or service aiders to the communities, and so men are thinking, and I tell this woman my problems, and then they will end up in another woman's ears, and then it will go around the community. No, I will stay on the phone. How do we deal with that?
Yeah, like you just said, there is no person outside there who would want to hear their story being talked to by another person. So everyone wants confidential listening. So the best way is the practitioners, also, or the person who need the help, to seek help from professionals. Professionals are trained to keep confidentiality. So once people trust the system that when I seek for service, I'm actually supported, quality service provided, but also my information is kept confidential. So someone will feel free to actually recommend a friend for that kind of service. But again, like you said, that many initiatives outside there are focusing so much on women's mental health, ignoring mental health. But again, like I said, because the society has put in there that women are more vulnerable to mental health as per the men. So you find that, but also many statistics show that women are actually suffering more with mental health than men. So no one is going to come out to think about supporting the men. Yet actually statistics are showing that it is actually the women outside there who are going through a lot of mental health conditions. But Eddie,
could the statistics also be informed by the fact that women are more willing to let out, to share things that they're going through, or participate in these surveys to collect this data compared to men?
Yeah, sure. Because again, I'll come back to being stigmatized. Women are always willing to support just for any intervention, for any kind of study, for any kind of research. Women will always be available because they feel free to participate for interventions. Okay. Unlike men, they're very, reluctant to this kind of service. Again, they feel like, so what am I going to do there? But also, they feel that time has been taken up. That is something will take a lot of my time. I would either be here making money or being so busy than, being participating in a study. So there are very many contributing factors.
Okay, speaking of money, have they also, the men, given financial constraints as the reason as why they cannot uptake, these services as far as mental health is concerned?
Financial constraints or challenges is among the many contributing factors why people don't actually seek service, because the mental health service outside there are very expensive. You need to know that. But the few organizations that provide this service at a free cost, they're actually very few. Some charge, some cost. So for example, you might go for a therapy and one session is about 100,000. Few people might sustain that, especially with the high levels of unemployment. So you find that the service outside there is very expensive, but also the high levels of unemployment. One of the other factors I would look at why there would be high levels of mental health condition, much as the high levels of unemployment or financial constraints. I look at marital conflicts and family. Because of the high levels, men are expected to be providers, and the family have high expectation about them providing. So the moment they fail to provide, and the pressure that comes along with that, this might also trigger their mental health. So it can also be a reason why they would, get into a state of mental health.
Okay, all right. I'm glad that you have mentioned, a family setting in there, because my next question then begs, what are some of those sources and causes that have come out loud and clear as sources or gaps where men are actually getting continuous mental health disorders from?
Contributing, I would look at the gender, culture and gender norms. Like again, I said, the culture puts outside there that men are always strong, but also men should not just go and seek help. They can't always handle this. So this is a high contributing factor. Again, I would take it back to there are also high levels of substance use. In the recent studies, very many men or very many individuals outside there are actually using a lot of substance. So frequent use of substance, chances are high that you'll get to the state of substance use disorder, but also develop other mental health conditions like anxiety and depression, which are one of the most common mental health conditions clients present with, or men might present with. The other factor I would look into as a major challenge, again I said, I go back to unemployment. The high levels of unemployment in Uganda triggers actually men's mental health, because if you can't even just provide for yourself, so then how are you going to survive? Because of this too much worry about unemployment, how do I support myself and how do I develop? This triggers men's mental health. But another important point we need to know is the limited access to services. Like as right now, if you look into the public mental health services, drugs are not there. Professionals are not there. So where can one seek service? Where can one go and understand the early symptoms before it actually advances to a level of severity? So if all this is put in place, then men's mental health can actually be managed, or it can be prevented.
All right. As Mental Health Uganda, what are some of those avenues you are using to actually address mental health disorders for men specifically?
Currently at Mental Health Uganda, we are running a toll-free line, a toll-free mental health line, which is 0800 21 21 21. Now, this service works from 8:30 to 5. It provides a lot, it provides assessment, it provides counseling services, provides therapy, but also referral services to men, but also to every other individual. So you just call in within those working hours and you get the support. So one would want to ask, so who works in this mental health helpline? We have we have professionals in the helpline, we have counselors in the helpline, we have psychologists in the helpline, we have social workers in the helpline. So it's a comprehensive team that provides the service. So because we realize that men don't want to seek physical help, they prefer, being in darkness, but also seek the help. So the helpline is actually supporting a lot. But also Mental Health Uganda, we've looked into the peer-to-peer kind of model, whereby we identify persons with lived experience. So these persons are in the communities to actually provide service to fellow peers, because a man would actually feel free to discuss with a fellow man about their mental health condition than discussing with a lady. But as part of our champions or our peers, we have both the male and female who are trained and they're actually in the community there and providing the support. Also in this way, we have extended mental health services to community level. Okay. Because currently, mental health services are, at institution level where, people have to go to hospitals, but for getting out at the community. So we've done a lot of training to VHTs, peer-to-peers, but also with the local leaders in the community. Okay,
so you as a clinical officer, you receive these cases on a daily, you're talking to men, you're hearing their plights and their sorry state as far as mental health is concerned. Who gets to help you, Eliah?
That's a very nice question. As a clinical psychologist in practice, normally as part of our ethical practice, we have whom we call a clinical supervisor. So me as a clinical psychologist, yes, much as I receive a lot of cases from clients, but I also have a clinical supervisor, someone, whom I go for support, clinical support. That sometimes cases are overwhelming. Sometimes you also feel the burden. There's what we call, secondary trauma. Because then I support many people with, traumatic cases, but also see them. I might also get to a state of one time developing a mental health condition. So I have a clinical supervisor that I report to. We discuss these cases, but they support me, in terms of counseling, but also clinical work.
Okay. One last question. At what point should men actually seek out these services, and also how can us women help?
Them, at a point of seeking service might differ, but anytime, first of all, when people understand what are the simple signs of mental health conditions, it is from that point someone understands, okay, so at this point I think I need to seek service, especially when you find, for instance, you start to withdraw, you start to lose interest, start to worry too much. Now, these are some of the signs and symptoms of mental health conditions. So when you identify these signs or you think you're having any of these signs, it's also very important to seek help, to talk to someone. But also at what level, maybe when would a woman support? Again, a woman can support at any level. There's only where you say, okay, at this point I'll come to support, but you can always be that, provide emotional support, but also, assurance to a man that, this can be okay. It's okay that we've understood your mental condition, but we can support. So you can always be that at any point in time to support the man, but also for men, at any point you feel you're having any typical kind of behaviors, too much worry, it's important to seek mental health service.
Okay, all right. As you give us your closing remarks, please also do share the toll-free call number.
My closing remark is that for our listeners outside, especially the men, speaking up about mental health doesn't mean you're actually weak. It actually just shows that you're courageous enough, but also you're a human being. Yeah, but also we need to know that mental health is not luxury; it's a human right. So feel free to seek help, to talk to someone when you feel you're going through any kind of challenges or situations that you might not be able to manage yourself. But you can also seek service from professionals. It's good to go to professionals to seek services. You cannot manage things on your own or go to, let me say, local traditional healers there for this kind of support. At Mental Health Uganda, you can call us on our helpline, which is 0800 21 21 21. This helpline, again, I repeat, it is for free. It's free service. So just call in, then you'll get support from our qualified staff who are on the helpline.
All right, Eliah Motto, thank you so much from Mental Health Uganda, and thank you so much for encouraging men. And we do encourage men to actually seek mental health services because we are better together. It's okay not to be okay. And of course, your mental illness is not your real illness. It is something that has a solution to it, if only you can actually reach out for those solutions. And also, your struggles do not define you, our dear men, and so be encouraged by that as you reach out for these services. That brings us to the end of Talk of the Nation. We do return with more news. Do stay with us.